everybody. Myself, Dr. Manoj Pujar. I'm a consultant physician working at Devangere. I have my own setup called Puja Hospital. My specialty would be diabetes and cardiology. I'm a non-interventional cardiologist, and then I practice diabetes. Today, I'm going to share some of my thoughts and some of my experience regarding this, what is going on in the whole world, the pandemic of COVID-19 and its impact on diabetes and hypertension and cardiovascular disease. As you all know, COVID-19 has reached its pandemic proportions throughout the world, and it's been happening in every corner of our country as well. And you must be knowing there are so many people who are dying, so many people are getting infected, and so many people have been getting infected as well as infecting others also. So here I would like to just bring it to your notice what is COVID-19's impact on a normal population, on people suffering with diabetes, hypertension, and cardiovascular disease. See, as such, any viral illness for that matter, it's a very mild viral illness until and unless there is some other factors, what we call as comorbid factors, which lead to a lot of casualties, I mean to say morbidity and even death. Similarly, in this COVID-19, coronavirus 19, we have been seeing different patterns of presentation in different people and different parts of the world. And one thing is common, what we see is that many of the casualties, what we see, many of the deaths, what we've been seeing across the world, even in India, it's been in the people with the comorbid conditions like diabetes, hypertension, and cardiovascular disease, and of course, not to mention the age of the patient or the age of the person. More than 60 years of age, people are vulnerable to succumb to this disease. And let us go in detail and then see what exactly the COVID-19 does in people with cardiovascular disease and hypertension and diabetes. First, I'll take diabetes into consideration. So diabetes, you must be knowing, it's a chronic disease which is what we call as metabolic disorder of sugar metabolism, which can involve any part of the body. And the duration of diabetes makes a very important role. The more the duration of diabetes, the more the complications as such. I'm not just relating right now with COVID and diabetes, but as such diabetes, duration of diabetes plays a major important role in other comorbid conditions as well. So a diabetic person is very prone to any kind of infection, especially this COVID-19, because diabetes will bring down your immunity levels, and then the opportunistic infections and the viral infections are known to go up or flare up in diabetic people. The diabetic people, mainly people who are having very poorly controlled diabetes, are much more vulnerable. Their immunity levels are very, very low, so they succumb to the disease very fast. Why? Mainly because the diabetes, the uncontrolled diabetes, and the duration of the diabetes, say diabetes duration of more than 5 years, 8 years, 10 years, and then go on, those patients will be having very less immunity, so that they cannot battle with the coronavirus or for any virus for that matter. They cannot battle. Their immune system is so much damaged, their immune system is so much non-adaptable to the inflammation which caused by COVID-19. They succumb. They do not do well as compared to the people with without diabetes. Okay, so the main thing why people with diabetes succumb is mainly because of the immunity, reduced immunity, or they are something called as immunocompromised. So immunocompromised personnel with poorly controlled diabetes are the person who succumb to disease. And there are other factors as well why diabetes and COVID-19 have so much of impact on mortality. Diabetes is also known as a thrombotic disease. That means to say, diabetic people, their arteries, their blood vessels are narrowed, thickened, and there are other factors as well like dyslipidemia, which causes their vascular or the vascularity or the blood vessels to thin out, and the accumulation of cholesterol or what we call as plaques are much more. And added to that, when you have a COVID disease, COVID coronavirus, this especially the coronavirus 19, what we've been seeing now, it is known to cause some amount of coagulation mismatch or coagulation profile disarrangement. That means to say, even in normal person, COVID-19 can cause some amount of thrombosis. Like mean to say, our heart, our blood vessels are filled with thrombus. Nothing to say about clot. Thrombus is nothing but clot. So when you have diabetes and along with that, when you have a COVID infection, the chances of the coagulation mismatch of the coagulation profile disarrangement or what we call as our arteries get blocked quite easily, and this can impact our heart, our kidneys, our brain, our eyes, and to be known as the multifactorial or the multi-organ failure. So this is the reason why diabetic people, they succumb very well or very fast to the this COVID-19 infection. And we shall go to the cardiovascular disease. That means, if a person is having a cardiovascular disease or what we call as a thrombotic disease or coronary artery disease, that means, the patient has already had a heart attack or maybe a mild heart attack, or maybe a patient has undergone cardiovascular or disease, like, he must have undergone PTCA or stunting of the vessels of the coronary artery, or maybe a person has already undergone bypass surgery. And those patients again are in a risk factor for the development of severe COVID-19 disease because their heart is already damaged. They've already undergone so many procedures like PTCS stunting and CABG procedures, which have already made them a little bit much more vulnerable. Not to mention this cardiovascular disease, also many of the patients with cardiovascular disease, they are diabetic as well. So it is again twofold increase in the risk factor for the development of cardiovascular disease, diabetes and cardiovascular disease. Along with that, COVID-19 infection, absolutely, it is a dead triad, I would say, and these people succumb very well. Even in patients without having a cardiovascular disease or very minimal cardiovascular disease, which has gone unnoticed to them, and those patients with having a family history of coronary vascular disease, those people who are above 60 years of age, those people who are smokers, even though they don't have had a history of heart attacks in the previous level, previous to the COVID infection, they can present with symptoms of heart attack like symptoms during this COVID infection. That is again this mainly because the COVID infection, the coronary virus, it attacks our blood vessels. It causes a thrombotic state. That means to say this virus causes something called as clotting inside our blood vessels. The thrombotic state is more. So if a person who has not had a previous history of heart attack, although can succumb to the disease, he might present without having any fever, without having any cough, but he can present with something like heart attack, severe heart failure, severe heart attack, without having any other classical symptoms of COVID-19. So that we usually diagnose by seeing a troponin I levels. That means to say there are something like troponin I is an enzyme or it's a chemical which is released from the from the damage to the heart muscles, mainly the myocardium, which can mimic acute heart attack. And coming to these patients, it becomes very difficult for anybody, for a treating physician, surgeon or a cardiologist to pick up a case with COVID-19 without having any other symptoms other than having a chest pain and then coming to the emergency department or even ICU, and then we have to go through his history, go through his exposure, and then see all these cardiac enzymes. We estimate cardiac enzymes, look at the ECG change, and then whether really this patient has got really a acute coronary syndrome or heart attack per se, without an involvement of cardiovascular disease or without involvement of COVID-19, or is it a purely COVID-19 disease which is presenting in an atypical manner of heart attack or unstable angina or whatever. So this is very important to know that any person during this epidemic or pandemic who has a borderline history of cardiovascular disease, who one just present with acute pain or like heart attack like symptoms of severe sweating, acute pain, and breathlessness, those are the patients who need to be screened. And all the patients coming to the emergency department and ICU or cardiovascular departments or cardiologists or cardiothoracic surgeons, these are the people needs to be screened to rule out COVID-19 infection, especially in this time. So this is regarding cardiovascular disease and COVID-19. Thirdly, I would come to the last one, the hypertension. Again, hypertension itself is a risk factor for development of cardiovascular disease, as we all know. Again, these patients, again, they are very vulnerable for COVID-19 infections, and of course we know that as the age increases, the hypertension levels also go up. So people more than 60 years of age are the ones who are real hypertension, uncontrolled hypertension, or something called resistant hypertension. These are the patients who really succumb to the disease very easily, and then very fast, in fact, for that matter, during this COVID-19. It's the same pathway. As I said, it's all about our cardiovascular, our vascular tree involvement in COVID-19 infection, which is making life very miserable for these patients, and then they do succumb to the disease or the illness very fast. So what I would suggest is, all these patients with cardiovascular disease, the existing cardiovascular disease, those who have undergone already a CABG, those who have undergone a stenting of their heart vessels, those are diabetics, those are elderly more than 60 years of age, those are taking antihypertensive medication. All these people come under very high risk category for morbidity and mortality of COVID-19. So these are the patients need to be taken care of by everybody. It's not only the doctors, the paramedics, or everyone, for patient himself for that matter, and the support from his family, which is very important during this time, where blood pressure needs to be kept very well under control, their blood sugar needs to be under very well controlled, their cholesterol level needs to be very controlled, and of course you have to do some amount of exercise training so that your lungs are compliant, your lungs are working very well, and then there is some amount of benefit with the exercise, daily routine exercise as well, so that you can survive with this disease. If it's there in you, if you're already infected with COVID-19, you can still battle with it with your blood, very good blood sugar control, very good lipid profile or the cholesterol control. If your blood pressure is very well under control, you can still fight with this disease and then come out in a successful manner. So all in all, what I would say is, these are the people which are highly vulnerable. So it is very important to say what is said. The prevention is always better than cure. With this, I would like to end my talk, and thank you very much for your patient hearing. Thanks a lot.